Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on endocrine, diabetes and metabolism. Question number 15. For the following case, which of the following is the most likely diagnosis in this patient? A. Anaplastic carcinoma. B. Colloid nodule. C. Follicular adenoma. D. Follicular carcinoma. E. Medullary carcinoma. F. Papillary carcinoma. The case scenario is: a 61-year-old woman comes to the office due to a neck lump. She is otherwise in good health and has no other symptoms. Temperature is 36.7 degrees Celsius, blood pressure is 115/70, and pulse rate is 78 per minute. On physical examination, there is a non-tender, firm nodule in the left lobe of the thyroid. Laboratory results show a normal serum TSH level. Thyroid ultrasonography reveals a 2 cm hypoechoic thyroid nodule with increased central blood flow. Fine needle aspiration biopsy shows clusters of cells with large, overlapping nuclei containing sparse, finely dispersed chromatin. Numerous intranuclear inclusion bodies and grooves are also seen. The question is: which of the following is the most likely diagnosis in this patient? Your options are: A. Anaplastic carcinoma. B. Colloid nodule. C. Follicular adenoma. D. Follicular carcinoma. E. Medullary carcinoma. F. Papillary carcinoma. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is F, which is papillary carcinoma. This question is designed with the focus to assess your ability to make a diagnosis. The 4 main types of primary thyroid carcinoma include papillary, follicular, medullary, derived from the parafollicular calcitonin-secreting C cells, and anaplastic. The papillary type is most common, accounting for greater than 70% of cases. Risk factors include a positive family history of thyroid cancer and radiation exposure, especially during childhood. Papillary carcinoma cells are characteristically large with overlapping nuclei containing finely dispersed chromatin, giving them an empty or ground glass appearance, sometimes termed orphan Annie eye nuclei after a cartoon character whose eyes were drawn without pupils or irises. Numerous intranuclear inclusions and grooves can be seen due to invagination of the nuclear membrane. Somoma bodies. Laminated calcium deposits may also be found within the tumor. If you choose any option other than F, you are wrong. Let's briefly discuss the other options. A. Anaplastic carcinoma. Anaplastic thyroid cancer is an aggressive tumor with a very poor prognosis. It is most common in older patients, age greater than 60. Cytologic features include markedly pleomorphic cells, including irregular giant cells and biphasic spindle cells. B. Colloid nodule. Most benign thyroid nodules are colloid nodules formed from focal hyperplasia of normal thyroid follicular cells. On cytopathology, a colloid nodule consists of variable-sized thyroid follicles, colloid, and macrophages. C and D. Follicular adenoma and carcinoma. Follicular neoplasms lack the characteristic nuclear features and somoma bodies found in papillary tumors. Distinguishing a benign follicular adenoma from a well-differentiated follicular cancer depends on the presence of vascular and capsular invasion, which cannot be determined on a fine needle aspiration specimen. E. Medullary carcinoma. Medullary thyroid cancer appears histologically as polygonal or spindle-shaped cells with a slightly granular cytoplasm that stains for calcitonin. Extracellular amyloid deposits consisting of calcitonin polypeptide may also be seen. Medullary thyroid cancer is a component of multiple endocrine neoplasia types, 2A and 2B. Your take-home message from this question is that papillary thyroid cancer is the most common type of thyroid cancer. Characteristic findings on histopathology include large cells with nuclei containing finely dispersed chromatin, giving an empty or ground glass appearance. Orphan Annie eye, and intranuclear inclusions or grooves. Do you have the correct answer? You can go to the next question by clicking above, but only if you answered correctly. If not, you have to watch this episode again. It's essential that you comprehend everything. Learn how to pass your medical exams, especially the USMLE, with our amazing resources. Make sure you and your friends are ready by liking, sharing, and subscribing to our channel. Remember, your success is at your fingertips.